Millions face uninsured status as health premiums skyrocket. Up to 4 million Americans could lose health insurance coverage next month if Congress fails to act. As premiums for Affordable Care Act, ACA marketplace plans are set to jump dramatically. Despite the recent resolution to the longest government shutdown in history, a compromise on health insurance costs remains elusive, leaving millions facing unaffordable premiums or the prospect of going uninsured. The looming crisis threatens to reverse years of progress in expanding health coverage and highlights the systemic instability of the U.S. healthcare system. The impending coverage collapse the situation is critical. More than 20 million people purchase insurance through ACA marketplaces, and many are now facing sticker shock as premiums soar. Democrats secured a vote on restoring health insurance subsidies as a condition of ending the shutdown, but bipartisan negotiations are running out of time. Open enrollment closes on December 15th, leaving a narrow window to avert widespread coverage loss. Human stakes. Voices from the front lines, interviews with individuals directly impacted reveal the harsh reality of the crisis. People are forced to make impossible choices, skipping medical appointments, stockpiling medications, or going without coverage altogether. The interviews highlight the desperation and frustration of those caught in a broken system. The contractor, a broken promise. Hussein Kabura, 45, an IT contractor in South Carolina, ironically works for a health insurance company but does not receive coverage through his employer. His family's plan, previously affordable, now costs $285 per month, a five-fold increase. Kabura is considering dropping coverage for himself and his daughter to ensure his wife, who has an autoimmune disease, can maintain hers. If I cannot get insurance, or if either of us, we're gonna go back to the old way of doing things. We're gonna have to go to the emergency room for stupid shit, Kabura said. He is resigned to the possibility of going uninsured, planning to stockpile prescriptions before his current coverage expires. The asthmatic, forced to gamble with health. Ian, 36, in San Antonio, Texas, works part-time while caring for his parents. His ACA plan, previously under $100 per month, now costs $282 with a $10,000 deductible. He relies on medication to manage asthma, but without insurance, inhalers could cost $50 each. Do I really need health insurance at this point? Ian asks. Texas has the highest uninsured rate in the country, and he is considering relying on discount programs or going without coverage altogether. Healthcare needs to be fixed, he says. The entrepreneur, a system that punishes risk-takers. Samuel, 47, left a corporate job to start his own business. His ACA plan, previously $480 per month, is now $580 with an $8,500 deductible. He fears hospitals refusing care to uninsured patients and is weighing the risk of going without coverage. I don't trust the hospital, he said. Most likely, the way I'm looking at it now, because a hospital could potentially deny me service for not having health insurance, that basically forces my hand. The retiree, forced to sacrifice retirement security. Stephen, in his late 50s in New Jersey, lost his wife's employer-sponsored coverage after her division was shut down. Their ACA plan, previously $500 per month, is now $2,700 with a higher deductible. They are forced to withdraw money from their retirement savings to afford coverage. We cannot wing it and not have health insurance, Stephen said. I'm spending a lot of money that I really do not have on health care. The bottom line, the looming health insurance crisis is not just a policy debate, it's a human tragedy unfolding in real time. Millions face impossible choices, forced to gamble with their health or sacrifice their financial security. The situation demands immediate action from Congress to stabilize the ACA marketplaces and ensure affordable coverage for all Americans. Without intervention, the U.S. healthcare system will continue to fail those who need it most.